Hi, how are you today?
Good.
Oh, let's get you set up in that chair.
Oh, thank you.
Does that feel better?
Yep.
My name is Justyn. I'm the occupational therapy student that will be working with you today. I am going to be just kind of checking your vitals before we get started on our treatment and talk about any other information before we send you back home. Before we get started, I want to just verify a few things. Can I get your full name?
Dave Driscoll,
And your date of birth?
2/17/1955.
You've been very busy today.
Yeah, I've been running some errands.
Oh yeah? You've
Yep.
been doing those on your own? Did someone go with you today?
And my wife is my chauffeur.
Oh, really? Alright, I'm gonna kind of just set your arm up here. I'm gonna test your blood pressure first. Or not test it, sorry. I'm gonna get your blood pressure. And just relax your arm for me. Thank you. I'm gonna do it on your right arm because I know your left side is affected. So I'm just gonna test it over here so we're not bothering that arm. Does that feel too tight? I got 119/78, so normal's 120/80, so we're not really too concerned about that. How's your blood pressure usually?
Usually a lot higher than that, but my wife checked it this morning and it was pretty normal.
Okay, well, as we continue to go throughout today, I'll just check in on you and make sure you're still feeling all right, and go ahead and just kind of relax your arm for me. Get this going. So this tests your heart rate and your oxygen levels. You have some pretty nails.
Thanks. Blue's my favorite color.
Mine too. Reminds me of the sky in summertime. So it's taking a little bit longer to read, and that might just be because you do got your nails painted, so didn't want you to worry if it wasn't reading right away. We got your heart rate at 71 and your oxygen at 98. Really good. Everything's looking normal. Oxygen's usually anywhere from 95 to 100, and heart rate is anywhere from 60 to 100. That's normal, so that's good. Well, do you got any big plans for today?
Not really. I'll probably be tired after this. I'll probably go take a nap, but might watch some of my hunting shows.
Oh yeah? What's your hunting shows about? Like where they hunting deer, elk?
Deer.
Oh, yeah?
I'm trying to learn some new skills to really, get a bigger deer than I normally get. My son has bigger ones than I do on his wall, so.
He does?
Yeah. That just can't last.
Y'all go hunting a lot together?
Yeah.
I'm just gonna finish jotting down some of these notes. What are you doing after this?
Just getting back in my car going home.
Hey, that's sometimes the best thing to do. I like going home and kicking my feet up and watching my TV shows too.
I sit in my lawn chair, my recliner.
Hey, lawn chairs aren't bad either. Sometimes sitting on that front porch, it's all the therapy you need. Alright. I'm just going to kind of clean this stuff up before we get out of this room and head to the next one to work on just some assessments and kind of just find out some more information about you. Alright, now that we've done your vitals, there are a few questions I just want to cover before we get started with the rest of our treatment today. How do you perform your daily activities?
Usually sitting down. It's just easier that way, not have to worry about my left side, and usually I have like a nurse aide come and help me perform all my activities because I do struggle, and if she's not there, then my family comes and helps me.
Okay. What are your main concerns?
Really just this left-sided weakness and how it affects me being able to be independent in my daily activities. It keeps me from doing, home maintenance and like self-care stuff with my family and just stuff like that.
Yeah. What are some of the things you enjoy doing that has kept you from?
Well, I don't hunt as good as I used to. I still can hunt, but not as good.
Oh, yeah.
Keeps me from bowling and fishing, and I can still watch my Western shows.
Well, that's good.
Yeah.
Can't not have those.
Yeah, and I can still kind of play cards, but everything's just harder.
Well, it sounds like you like to do just a little bit about everything.
Mm-hmm.
Any adaptive equipment you use?
I typically use a cane to get around, but that's only if I'm familiar with the area. If I'm not familiar, I want to use a wheelchair just because I don't want to take the risk.
Okay, yeah, I understand that completely. Do you ever get sleepy or tired throughout your day?
Well, just because I'm so used to being independent, I try and do as much as I can, and sometimes I overdo it, and that makes me pretty tired.
So it's kind of more from like just frustration and trying so much rather than like sleeping?
Yeah.
Okay. All right. Well, thanks. I think this will give us a good start on today's therapy session, and we will start performing some of those assessments. I think will be really helpful. Okay. Before we get started today on this assessment, I just have to kind of check some things that might affect the outcome of your score so I can document it. Have you taken any medicine lately?
Mm-mm.
Okay. Any use of drugs or alcohol?
Nope.
Okay. And I know you've had a stroke, so that is already jotted down, and we're ready to start. Okay. All right. Before we get started, I want to just double check that the brakes are locked, because here in a second I might have you move around some. For the first assessment of the day, we will be doing the NIH stroke scale. And this is an assessment that has been developed and researched by the National Institute of Neurological Disorders and Strokes. And it will just be testing your neurological functions and some other deficits that you might have through having you do some physical and mental tasks. Okay. All right. Can you remind me of your birth date?
It's 2/17/1955.
And do you know what month it is?
April.
All right. I want you to open and close your eyes. And with your right hand, can you make a fist and then open it? Perfect. I'm actually going to kind of help make you a little more comfy here. Does that feel a little bit better?
Yep.
Okay. Okay, for this next part right here, I want you to make sure you keep your head still for me, okay?
Okay.
And then can you see this?
Mm-hmm.
Perfect. And then I'm going to just kind of take it across and follow it with your eyes. Okay. All right. For this next part, I am going to have my hands up on both sides of your face, and then I am going to just have you tell me if you can tell how many fingers I'm holding up. Okay. All right.
1. I can't see anything.
Okay.
2. Can't see it. 2. 2.
Okay. All right, next I want you to kind of just smile really big for me and close your eyes. Perfect. All right, now here in a second, I'm going to have you hold your arms out at 90 degrees and see if we can hold it up for 10 seconds. 10 seconds, sorry. All right, let's start with your right arm. Ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, now let me test your left side. Whenever you're ready, you can start. 1, 2, 3, 4, 5. Okay, now I am going to test your legs. So what you're going to do is just extend your leg out and just see if you can hold it up for 5 seconds for me, okay? All right, ready? Go. 1, 2, 3, 4, 5. Perfect. I'm going to test your left side. Whenever you're ready. 1, 2, 3, 4. Okay. Perfect. Okay, for this next part, I want you to take your pointer finger, and touch your nose. And then I'll have my finger out here, and I want you to try to touch my finger, okay? Ready? So let's do it with your right arm first. So touch your nose, come touch my finger. Okay, I'm going to go a little bit farther out and do it again. Finger, nose, okay? One more time. Finger, nose. Okay. Now your left side. All right. All right. Now I am going to move these real quick. Can you put your right leg down? I'll help you move these. Okay. This time, I want you to take your right heel and touch the opposite knee. All right, ready? Go. Now the same thing with your left side. Perfect. Oops. Oh, here's my pen. Okay. Get these back on here for you. Now I am going just to take this little kind of iPad pen. As you can see, it's not going to be sharp at all, but I'm going to use it kind of just to help for you to determine if I'm touching your left side of your body or your right side. And I want you to tell me, when I go through this, I'm going to have you close your eyes, and I want you to tell me what side you feel it on. And then if you feel any difference, like, oh yeah, I can feel that, or no, it's a little more dull, like it's hard to feel, please let me know that too. All right, ready? Close your eyes.
Right side. Left side. I think left side, but definitely more dull feeling. Right side. Right side. I think the left side.
Okay. All right, now I'm going to show you a photo, and I want you just to describe what you see in that photo.
There's a person falling off a ladder that is painting a wall, and then there's a dog that is running and chasing something. And there's some paint, I think, on the floor, and some mail on the ground, and that's everything I can see.
Okay. Thank you. All right, same thing again. I'm going to point at a certain object, and I just want you to tell me what you see in that object, okay?
Okay.
Or what the object is. Okay.
A stoplight. Bicycle. I think it's a leaf. A mouse. A little bridge. I see a handle of something.
Okay. Perfect. And
I don't know what that is.
okay. No worries. Nice. All right. Now I'm going to have you just read off a few sentences for me. Get my paper signed up.
Know how. Earth. From work. In the dining room. Speak on the.
All right. Thank you. Now it's just some words again. I just want you to read off what they are.
Ma. Top. 50. Berry. Player. And pillar.
All right. Thank you. For this next part, I am going to be testing your vision and sensory. And so I might have to just touch your skin a little bit. Is that okay?
Mm-hmm.
Perfect. All right. So I want you to focus your vision straight ahead on me, and then tell me if which hand you can see moving.
Okay.
Ready?
The right one. The right one. The right one. The right one.
All right. Next, I want you to close your eyes, and I am going to here. Let me fix your foot a little bit there for you. I'm just going to kind of touch the different sides of your face, and I just want you to tell me what side you feel that on. Okay?
The right one. Left. Think both. Left one. The right side. Both. The left side. The right side.
Sorry. All right, so that is it for this assessment. I am going to tell your scores real quick, and we'll discuss kind of what that means. All right. Still doing okay?
Mm-hmm.
All right, this next assessment is called the Fuglemeyer assessment, and it is going to be focused on your upper extremities. And based off of evidence provided by the University of Gothenburg, this is just will help give me a good idea of your body functions post your stroke. And since we've already tested some of what this assessment is asking me to do in your other assessments, I'm going to break this one up into parts. So I'm not making you redo something. So we are going to be focused kind of on your reflexes in your biceps and triceps, and just some different motions of your wrist and hand and some of your grip. Okay. So first I am going to test your bicep and tricep reflexes. So what I'm going to do is come in here. I'm going to have to touch you some. Is that okay?
Mm-hmm.
All right. So I'm going to just kind of relax your arm on me, okay? I want to do it this way. Relax your arm. I got to kind of feel for that tendon, that reflex. Nice, okay. Just keep relaxing it. I want to come back here and just look for some movement. Got to kind of feel for it first. Okay. Nice. Okay. Okay. Now I'm going to come to your left side. I want to test it too. All right, just relax your arm on mine. I'm going to feel for that tendon again. Okay. Okay. Keep relaxing your arm. Put it back down. There you go. Does it feel a little bit better? Yep. Okay, now we are going to look at your wrist. Bend your elbow to 90 degrees. Palm turned downward from this position. Without moving the rest of your arm, flex your wrist and hand upward and hold this position. Now I'm going to come and put slight pressure on your hand, and I want you to see if you can hold it. Okay. Now we are going to do the same thing. Go ahead and put it back like this. And I want to see if you can bend it up and down several times. Okay. Now back to your left hand. I'm going to do the same thing where you bend your elbow to 90 degrees and flex your hand upward if you are able. And then I want to come and put pressure on your hand and see if you can hold it. Okay, let me come support your elbow. Okay, go ahead. Okay. Okay, now put it down. Now lift your elbow up or your arm up, and I want to see if you can, with your left hand, flex your wrist up and down, your hand up and down with that. Okay. You can rest now. Okay. Now I want us to do, we're going to kind of do the same thing, but this time I want your shoulders slightly flexed, and then flex your wrist again with your hand up towards the sky. And then I'm going to come and press on your hand and see if you can hold that. Let me come around where I can support your elbow. Okay. Now you will extend your elbow and go back to where your shoulders slightly flexed and show me if you can move it up and down. Okay. Now for your left side, extend, flex that shoulder slightly and show me if you can extend that wrist up and down. Okay. And go ahead if you want to while I'm here. Can you move it up and down any? Okay. Now we are going to perform circumduction of the wrist. So bend your elbow to 90 degrees, palm turned downward. From this position, without moving the rest of your arm, make a circle with your hand by moving the wrist. Now for your left one. Okay, can you move it a little bit? Now we are going to move on to your hand. So I'm going to have you hold your elbow around 90 of your right arm. Open your hand and then bend your fingers, making a fist, full fist with the thumb outside the fingers. Okay. Now I want you to open your hand and extend your fingers as much as possible. Now we're going to do the same thing with your left hand, and I'm just going to come to support your elbow. Okay. Can you bend your elbow to 90 degrees if possible? Now make a fist with the thumb outside of your fingers. Okay, now I want you to extend those fingers as far as you can. Now I want you to open your hand flat and straighten your fingers. From this position, bend your fingers but not your knuckles. So like just bend your fingers for me. Make your hand kind of look like a hook. Hold this position when I pull my fingers against your fingertips and draw away from you. We're going to do the same thing with your left hand. Okay, so flex that elbow for me a little bit. Can you straighten your fingers and then kind of just make a little kind of hook for me? Okay, I want just to see if you can hold it. You can relax. Okay. Open your hand flat and straighten your fingers. This will be of your right arm again. From this position, keep your hand and fingers straight and bring your thumb up against the base of your index finger. Now hold this paper between your thumb and the side of your index finger. Now keep your fingers and knuckles straight while I gently pull the paper away. Same thing now with your left. Okay, now I want you to take part of the pencil from me, or take the pencil from me between the pads of your thumb and index. Hold it firmly while I pull it. You can hold it if you can. Okay. Now we're going to do the same thing with your left hand. Now we are going to take this can. Grab the can and hold it with your hand, with your fingers and palm tightly around and the thumb on the other side of the can. Hold it firmly while I pull it. Perfect. Now for your left. Alright, now I want you to grab this tennis ball and hold it where your fingers are facing away from each other. And then I want you to hold it firmly while I pull it away. Perfect. Now with your left. Now we are going to test your coordination and speed. Sit straight with your hand on your knee. While keeping your eyes closed, bring the tip of your index finger to the tip of your nose as fast as possible 5 times. I'm going to take the time. So you will go. All right. And go. Oh, there's 5. All right. Now with your left hand, whenever you're ready, close your eyes and do the same. All right, one more. Perfect. All right, now we are done, and I'm going to total your scores, and we will discuss those with you. Right, now we are going to be performing the modified functional reach test, and I chose this because based off of evidence provided by Charlie Ryan Ability Lab, I think this would be really good for me to be able to see what your dynamic sitting balance is while you're doing those daily tasks. And basically what that is saying is, so when you are doing your grooming or making your meals and you're reaching around, I want to just make sure that we're safely balanced, and this will help me be able to test that. And I did go ahead and take your foot pedals off because I want your feet do have to be flat on the ground. So I wanted to go ahead and get those out of the way. And I am leaving you in your wheelchair since you do complete your task at home most of the time sitting down, and you feel the safest in your wheelchair. So for this first one, I'm going to have you put your right arm straight forward. And then don't do it yet. We'll do it here in a second. And then I'm going to have you lean forward as far as you can, okay? You don't want to lean so far where you've become unbalanced and feel like you're about to fall. I'm just reaching what your normal functional reach is, okay? I'm going to stand behind you and grab a hold of your gait belt. And I had my lovely assistant, Morgan. She's my occupational therapy assistant student. And she is going to be helping me just get those accurate measures because I feel like if I leave you, it will cause... you'll be unsafe. So whenever I'm going to go ahead and have you set up a little bit so I can grab your gait belt. And whenever you're ready, you can go ahead and stick your arm out and she'll get your starting point. And lean forward for me like you're doing the Superman a little bit. Okay, then you can come back. And we will repeat this 2 more times. So whenever you're ready. Perfect. You can rest. Right, ready for the last one? Yep. Perfect. Okay. And go. Still feeling okay?
Yep.
All right, now we're going to switch positions. Okay, so now we're going to be performing this on your right side. So basically the same thing. I'm going to have you put your right arm up, and then you're going to lean to the side for me. I'm going to go ahead and remove this arm for you. Move your arm just so bad. I don't want it to smack you. Okay. I'm going to stand on this side just because if you were to start going, it would be easier for me to hold onto your gait belt and push you back into your chair. All right. Whenever you're ready, you can put it up. Make a fist. And lean. Come back and rest. We got to do this one 2 more times too, okay? All right, ready?
Yep.
Okay. And lean. And you can come back and rest. All right. And lean. All right. Let me get this one put on, and then we're going to move to the left side. All right, now I'm going to test your left side. I'm going to double check your brakes are on. Let me get this arm moved out of the way. Or actually, I'm going to have my assistant get this arm so I can go ahead and stand on her left side, or her right side, and have a hold of your gait belt. Okay. Whenever you're ready, you can lift that arm up as much as possible. Okay. And lean. Come back and rest. You feeling okay?
Yep.
Whenever you're ready, you can do that second one. And lean. Give you rest. And then whenever you're ready to do the last, you can begin. All right, you can lean. Perfect. All right, can I see that arm? All right. Now that we've completed your assessments, I just want to walk through the scores with you and kind of discuss what that means or what it has shown me. First, I want to address the NIH stroke scale. And you, out of a total of 42 points, you scored a 13. The lower is better, so kind of like your golf, the lower the score, the better. So since you did score 13, that just shows that it's kind of like mild to moderately severe stroke. But some of the main things I did notice that did need working, or some working on, was that range of motion on your left side. So based off that assessment, I think that's where we're gonna I saw where we need to focus. There's some other things, but the most important ones I want to focus on right now is that range of motion. Okay, so I now want to talk about your Fugelmeyer assessment. Usually it is based off of a score of 66, but since this assessment does allow me to break it off into sections, it is only, what we did with you is only based out of 32, and it was a 15 out of 32. And once again, this assessment just showed me with like your wrist and hand and grip that there's some strengthening we need to do and range of motion on that left side. All right, so when looking at your modified functional reach score, for the most part, when you leaned forward and to the right, it fell within the normal range. There isn't a set normal range, but based off of a study done with asymptomatic adults, you did fall within that line. The only one, once again, that we're worried about or looking at is when you were leaning to the left, and that's just because once you couldn't get that arm up all the way. So, based off the 2 assessments we talked about earlier, and based off of what this is showing with that left side, we've really got to start focusing our treatment on your range of motion. Okay, now I want to discuss some of your MET levels, and what that is MET just like the amount of energy you're using to complete an activity. And to kind of further explain that is like 1 MET is just what we're doing right now, just sitting here pretty much, and or what you're doing is just sitting. And then like there's 3 to 4 METs. So like showering would be you're using 3 to 4 METs. I went through based off of what we talked about today throughout our treatment, and highlighted for you what you're kind of mainly spending your energy on. I'm going to send this home with you too, just so you can look back at this, because I know there's probably some stuff on here today that we didn't discuss. And so I just want you to be able to know like where you're spending most of your energy at. So I'll give that to you. Like kind of like light meals, that's 1 to 3 METs. And I know you want to work on snacking, so we definitely want to kind of look in that area. I know you like watching your westerns, and when you're walking around, that's where it's kind of like spending more energy. And I know you want to get back to golfing, and that's 3 to 4 levels of METs too. So I think based off of some of the range of motion exercises I'm going to send home with you will be able to help you get back to doing some of those things. Okay. And I'm about to show you a lot of papers, but don't worry, I'm going to send home this little folder with you right here. So it's easy for you to kind of keep track of and bring back and forth to our treatments. Okay. Now I want to talk to you about this energy conservation booklet that was provided by the Blackpool Teaching Hospitals. It kind of talks about what energy conservation is and kind of how we can do it. And I know you said you got frustrated sometimes, and that's where a lot of your energy goes, is when you're trying to complete a task. And so it talks about 6 P's for more energy, and I think this would be kind of really good for you to go through, just to kind of help you when your attitude or when you get down on yourself or you're trying too hard. So the 6 P's are prioritize, plan, positioning, pace yourself, positive attitude, and pursed lip breathing. So it goes through and describes like what each of these are. And one thing I did want to talk about was pursed lip breathing. So it's like you're smelling something, and then you're trying to whistle. So it's kind of a way just like to really relax that body and try to refocus that energy. And then it goes through, and I made sure it included some of the things that you talked about that you do and want to get back to doing independently, like personal hygiene. So sit down to undress, wash and dry. You already do this, but it also offers some adaptive equipment advice that I will address with you next session, like a long-handled sponge. And literally it's a sponge on a long handle. So maybe this will help you not use as much energy, and you can be able to reach around your back and stuff. And then it will go over dressing, cooking, housework, because I know you said you wanted to be able to get back to helping your wife around the house. Laundry, how you can do that too. And the back page is just showing where I got this information. And then if you have any more questions, of course, you can always reach out to me. Or if your wife was wanting to look into this some more too, or it shows you the website I got it from as well. So I wanted to make sure I included that page. Okay, so like we said, our main concern right now is getting that range of motion back in your left side. So Hamilton Health Sciences Patient Education provides a really good self-range of motion exercise for the arm and hand. And I highlighted some important things for you to remember. It just says these gentle movements are called self-range motion exercises, and they help maintain your movement, prevent stiffness, improve blood flow, and increase awareness of your affected arm and hand. So that's the main reason I chose this, is because that's what we're focusing on right now. And of course, I also highlighted this: stop if you feel pain. At any time, if you feel pain during this, I want you to stop. And you can also reach out to me if you have concerns. I put my contact on here. So you will be doing these exercises 2 times each day, in the morning and at night. And I want you to complete them 3 out of 7 days a week right now. Next week, if this goes over well with you, we will talk about increasing the amount of days, but right now your arm might be really sore as we're building the strength and range of motion. So I think 3 days would be good to start off with. All right, I'm going to have you hold each exercise for 30 seconds, and then, like I said, you'll repeat it again once at night. Okay, so I will show you what they are, and then I will have you demonstrate it back to me, okay? All right, I want you'll interlock, or would you rather do them when I'm doing it?
Sure.
Okay, so you're going to interlock your fingers with your elbows straight and your thumbs facing the ceiling. Lift your arms to shoulder height. And we'll hold it for 30 seconds. Okay. This next one is called Rock the Baby. So you'll hold your affected arm by supporting the elbow and forearm and wrist, as like if you were cradling a baby. Slowly move your arms to the side, away from your body, lifting to shoulder height, and repeat the motion in the other direction. Slowly rock your arms side to side, keeping your body turned. I'm just going to have you do this 3 times on each side. Perfect. Are you still feeling okay?
Yep.
Okay. Next, we're going to do a shoulder rotation stretch. We're going to interlock your interlock your fingers and hold your wrist. With your elbows bent at 90 degrees, keep your affected arm at your side and slowly guide your affected arm across your stomach. So try and get it stretched out. So take it to the right. And then hold this for 30 seconds. And now slowly guide your forearm away from your body, keeping your elbow at your side. And hold for 30 seconds. When I do this, I just count 1 Mississippi, 2 Mississippi. You can do that, or if you have a little stopwatch, you can do that too. It's up to you kind of how you want to count time. Okay, now we're doing an elbow stretch. So we're going to interlock your fingers and hold down at your waist. Start with your arm straight forward and then slowly bend your elbow. And then we want to hold that for 30 seconds. And then slowly return to the starting position where your elbows are straight. Next, we are going to do a forearm stretch. Interlock your fingers and clasp your hands together. Place your affected hand on your lap or support it on the table. Perfect. Rotate your hands so the palm of your affected hand is facing downwards. And then hold this for 30 seconds. Rotate your hand so your palm of your affected hand is now facing upwards. You'll hold it for 30 seconds again. Now we're doing the wrist side to side stretch. We're going to interlock your fingers. Slowly bend your wrist to the left. And then we want to hold that for 30 seconds. And bend to the right. And hold that for 30 seconds. You still feeling okay?
Yep.
Now we're going to do the wrist forwards and backward stretch. We want to interlock your fingers. Place your hand on a supported table and slowly twist your wrist towards you. Hold it for 30 seconds. And now take it away from you. And hold it for 30 seconds again. Now we're going to go through, place your affected hand on the supported table. Individually bend each finger. When straightening fingers, do not bend them backwards, just straighten to your neutral position. So yeah, go where it lines up with your knuckles. We don't want to injure yourself. Okay, and then we want to go through and do that with each finger. Okay. Next, we're going to do the thumb and index finger stretched. Place your affected hand on a supported table. Place the thumb and index finger of your non-affected hand between the thumb and index finger of your affected hand. Stretch the thumb and index finger apart and hold it for 30 seconds. Are these making sense so far?
Mm-hmm.
If you have any questions, please feel free to stop me and I will try to explain it better. All right, now it's the thumb and pinky finger stretch. Place your affected hand on the table. Move your affected thumb so it touches the tip of your little finger. And then hold that for 30 seconds. Okay, perfect. And like I said earlier, if at all during that you feel pain, please stop, or if you're feeling lightheaded, out of breath, make sure you go do the pursed lip breathing. Just slow yourself down. We don't want you getting where you feel like you're going to pass out or overworking yourself, okay? And like I mentioned before, my contact is on here, so please feel free to reach out to me at any time, or if there's something happening and you think it's a severe case, then call 911, okay? And then they can reach out to me as your therapist later on.
Okay.
All right. Oh, sorry. One more thing. So I know you are wanting to become more active in some of those activities like showering and stuff that you're having to have assistance with. So through the occupational therapy toolkit, I found some of these little scenarios that shows you how you can use your left arm as much as you can during the day. Now, you don't have to make yourself go and do these, but if you find yourself doing these, you can refer back to these pictures and it just gives suggestions on how you can actively use that left arm. Like this one, if you are getting out of bed, it shows you how to use your left arm to help with bed mobility, or even carrying a piece of clothing. It shows how you can carry that underneath your arm, just so we can try to get that left arm more active so we can get you back to golfing and hunting. There's even like with eating. I know you're wanting to get more independent with snacking, so and making light meals. So it even shows you how you can use your left hand left hand and arm to eat a snack, hold your toothbrush, even self-grooming task. And then there's one on here, like if your kids, your wife, or your home health aide is with you, I'm even sending this one in here too that you can ask them to help perform with you. Kind of like wiping off the tables, combing your hair, just them kind of offering you some assistance while doing those things to get that arm as active as possible. Okay. All right. I will put all these in this folder for you. And once again, if you have any questions, feel free to reach back out to me. Do you have anything?
Nope.
Okay, perfect. Thank you.
Thank you.
All right, I think you had such a great idea about coming outside and finishing some of our treatment. There's just one more thing I wanted to talk about and send home with you. This is a little informative handout provided by the Ohio State University Medical Center. And this is just talking about how we can protect your shoulder and arm from further injury after that stroke. And one important thing is like when doing exercises or any activities at home, we want to make sure we're not lifting your left arm uh, where your shoulder is above or passes 90 degrees of flexion, or even if your body's arm is out to the side. All right, we just really want to protect your arm and try to prevent any further injuries from happening. And this paper will kind of go through and talk about it. And it even gives some positions for like good postures and ideas about how not to lean or slouch.
Okay.
All right, any questions?
Nope.
Perfect.